friends. It's Kimberly here, registered nurse and business development director with specialty care management. This week, week 5 of our kidney bites, where we've been sharing about the 5 major risk factors for kidney disease. This week, we're talking about the risk factors associated with a genetic predisposition or genetic conditions that cause kidney disease and its progression to dialysis. Thanks to so many of you have tuned in and followed along as we've shared these bites. Again, the 5 major risk factors, and we've discussed them here: diabetes, high blood pressure, heart health, the cardiorenal connection, obesity, and family history. Family history is a significant risk factor. There are some conditions like polycystic kidney disease, Alports, these kind of and other diseases that cause damage to the kidneys in various pathways and lead to dialysis. Now, keep in mind, these conditions themselves, while they're genetic in nature, keep in mind that genetics also plays a role in the contributing factors that we've also discussed: blood pressures, hypertension, diabetes. There's a role there. Heart health. There are some genetic factors there as well. So when it comes to genetic conditions, when somebody has a genetic condition like a polycystic kidney disease or an Alport or these kinds of things, a lot of times we think there's nothing we can do. Oftentimes, as a nurse, when I counsel and work with members, I hear things like, well, mama was on dialysis, so I've just been assuming my time was coming. And it doesn't necessarily have to be that way. Even if you have a genetic condition such that kidney disease is inevitable for you or for your members, there are still things that you can focus on. While you can't go in necessarily, at least not now, can't go in and change your DNA and your cellular structures, you absolutely can mitigate some of the factors that are going to trigger that progression or worsen or speed up that progression. Simple everyday things that you can do are to make sure that you're keeping a healthy blood pressure, make sure that you're keeping healthy blood sugars, that you're maintaining a healthy weight, and that you're eating a healthy diet. One that's low in sodium is going to be important for you. Not smoking, and if you do smoke, stop smoking or using tobacco in general. Keep in mind, cigars, you smoke a cigar is worth a pack of cigarettes in terms of nicotine. Nicotine, I'll go on a tangent here. A lot of times we associate smoking with lung health, and that's true. Keep in mind that nicotine use in any form is going to inhibit your body's ability to use or to get enough vitamin C that makes blood vessels nice and soft and elastic, not just your blood vessels and your skin. Keep in mind that the filters in the kidneys are largely made up of tiny little capillaries, right? So healthy vasculature is really important. This is why smoking cessation is really important as a mitigatable risk factor. Making sure that you're limiting alcohol and caffeine is important. Caffeine and alcohol, when used in excess, are diuretics, meaning they make you lose a lot of water. Dry kidneys don't filter very well, replaces a lot of nutrition that you would otherwise be getting. If you do need help with smoking or alcohol, there's lots of programs out there. I would encourage you to ditch the shame and work on understanding why those factors are there. Making sure that you're exercising most days of the week. It's recommended that we get a half an hour, 5 days a week, or 150 minutes per week. So these are all mitigatable things. These are all things that are completely in yours or your members' control. I have complete control over what goes into my body and how I move my body. Those things I have control over. I can't necessarily go in and change my cellular structure, but I can absolutely harness the personal power I have. And that does go a long way. Sometimes it doesn't necessarily stop the progression to dialysis, but it can absolutely have a role in not hastening the development to dialysis. Keep in mind that a lot of these factors, these self-care measures, are important in somebody's ability to qualify for a transplant. There are certain criteria that have to be met for somebody to do well with a transplant. Maintaining a healthy weight is one of those factors. If you have questions and want to know more about how our CKD management program can absolutely play a helpful role for your members to help them avoid that progression to dialysis, to slow it down, even to help them understand their options. Should dialysis be inevitable? Understanding options and designing what you want that to look like is incredibly, not only is it powerful, but it absolutely can save your group cost. Again, if you want to know more about how we help your members in such a manner, it's one of our favorite things to talk about. In the meantime, live well, be healthy. My friends.